Welcome to the Forsyth Magazines podcast. I'm Brooke Eagle, your host, bringing you the stories of the people shaping our community. From business owners to local leaders, we'll explore their journeys, passions, and lessons learned. Let's dive in. Hey guys, we are back with another podcast episode, and today I have two very special ladies from Atrium Health, Wake Forest Baptist Outpatient Imaging. We have Karen, the clinical manager, who has been on the podcast several times before. Hi Karen.
Hi.
How are you?
Good. How are you? Thanks for having us back.
So good. And we have Anissa, the senior physician liaison, and this is her first time on the podcast.
Yes, thank you for having us.
Yeah, thanks for coming
we're
on.
excited.
So, as we all know, October is Breast Cancer Awareness Month, and I just want to kick things off with some information from you guys that is always important to reiterate. Breast cancer awareness is always especially close to my heart. My mom is a 2-time survivor. Both of my grandmothers had breast cancer, so it's just something that I love sharing with the community so that they can be aware of what to be on the lookout for. So, Karen, what are some of the most important signs and symptoms that people should be looking out for?
So there are signs and symptoms of breast cancer. Then you should certainly talk to your doctor if you're having any of these, such as a new lump that does not go away with your cycle. If you're having some discharge that's bloody or green colored. Sometimes pain, but most of the time pain is more hormonal based on that. If there's a change in one whole breast versus the other breast, that's something that you want to talk to your doctor about. But what we try and do with mammography is we try and get these patients in before you know anything about it. So if you do your mammograms every single year, it can catch breast cancers 2 to 3 years before you can feel them. And so if we can catch them before they can get to your lymph nodes, the treatment options are much better. Your life longevity is much better. So, we definitely want people, if they're having symptoms and signs, to go talk to their doctor about it. But we want everybody to get those screening mammograms to try and catch those real early.
Yeah. And I know there is some fear, hesitation around mammograms. And I think I want you to kind of, or really both of you, to kind of bust that myth that it is really not that bad.
It's really not that bad.
It's not that bad.
It's not something that, this is what I tell all of my patients as well, especially the first-time patients, is that it's not something you want to do every day, but it does not have to be ridiculously painful. And so as mammographers, we want to get the best images that we can, but we don't want to hurt anybody in the process. And so everybody has a different experience in there. Everybody's breasts are different. Some people just have very sensitive, painful breast tissue. That's just their norm. So we would definitely recommend maybe a little bit of Advil or Tylenol before you come in. But it's very quick. It takes maximum maybe 15 seconds each breast. We do a couple pictures of each side. And for that peace of mind, it makes all the difference in the world to come in.
Yeah.
And so definitely.
In a little different perspective from me, like when I'm out in the field or I'm working on at a health fair, is I try to get patients or women to look at it from the perspective of, aren't we lucky that we've got these screenings? Thankful that we have these opportunities to do this. And honestly, we do run into a lot of women that are scared and they don't know what the outcome is. And I'm like, but the alternative, and who in your family, your loved ones, do it for them.
Oh, yeah.
And it really does kind of have them kind of think a little bit harder on it. So we really do focus on a little bit of the emotional part of it.
That's a great perspective shift. Kind of, I think of the same thing with exercise. Like, wow, my body I get to exercise. Like, how lucky am I that I get to? How lucky are we that we have this technology that we can get these mammograms? And speaking of that, the technology, I know the 3D mammograms are not like brand new, but it's like really come a long way over the years.
It has. So with the 3D, we have been doing them for a couple of years now, but I think the focus in the world right now is AI. It's all about the AI. The one thing about 3D is that we have AI integrated in that. And so it kind of gives a second reading to those images in addition to the radiologists that are board certified in breast. And so it's kind of two really expert eyes looking at things for every mammogram that we do.
Wow, that's
Yeah.
awesome.
Cool.
So, Anissa, what is the age that we should start getting mammograms?
40, the recommendations and the guidelines are 40. We've got a big campaign right now. We're starting 40 and Fearless. So we're really going to start targeting those women like that 37, 38, 39, 40 range. To really be thinking about where we need to get your mammogram.
Yeah.
So we're going to target some of the public, again, like health fairs, places like that. Of course, physician offices to remind them to make sure that they get their patients in and remind them to schedule their mammogram. So
Yeah.
40 it is, but sometimes a little earlier depending on family history.
Sure.
Or like Karen just explained, some early symptoms.
Yeah, I have lots of family history, and so I did the genetic counseling. So I've been getting mammograms since I was in my late 20s,
Yeah.
crazily. But and they are not that bad. But oh, it was on the tip of my tongue. What was I
And
going
then
to say?
everybody, I think all of us have been touched by breast cancer
Sure.
in some way.
Yeah.
We know somebody. So it's really interesting and kind of fun to see men and young boys really encouraging the women in their lives
I love
to get
that.
a mammogram.
Yeah.
Well, that's what I see when I'm out and we're doing these health fairs out in the community. Men will come up and say, okay, my wife needs to get it, or she's scheduled. Like, they're in the know. I think that's fabulous.
And and I think a lot of especially that 40 age, a lot of women in their 40s are in that crazy time of having young kids, and it's so easy to just put yourself at the bottom of the priority list. And so I think, like you said, that's really important that these husbands and men in their lives are encouraging, because it's not even always a fear thing. I think it's like, oh my gosh, I'm just too busy to do that.
Absolutely.
And
I'll get
time-
to it. I'll call them later.
Yeah, and then 6 months goes by, and then
Yep.
another 6 months goes by, and a lot can happen with the progression of a cancer in 6 months and 12 months.
And we're really good about if we talk to somebody and they're like, oh, I need to, I'm like, can we call you? Can I get your phone number?
Yeah.
Yeah, I will call you. You don't have to call us.
Yeah.
So we really do
Yeah.
kind of grab them.
I love that. So, can we talk about the dreaded like insurance questions? So, what if people wanted to come see you guys to get their mammogram? What would that process look like? If somebody's like, oh my gosh, I don't have a primary care physician, like I just don't even know where to begin to go about getting a mammogram.
So there's two basically different kinds of mammograms. One is going to be the diagnostic mammogram, and that's when you're experiencing symptoms. You're outside of your normal annual time to get done, or we're following up on something. If you've had a history of breast cancer, things like that, we'll put you into the diagnostic range. That's something we have to have a order from your doctor to do, and we just need to make sure that the imaging that we're doing, somebody is going to follow that up. So if there's another step that needs to happen, a biopsy or what have you, that you will be taken care of. So that is a requirement. The other is just the screen and mammogram. And so that's what we recommend every single year. So I think the Fearless at 40 is fantastic. I think that we need to get these ladies really thinking, oh gosh, 40, yep, I guess it's time to get that started. But we also want to really stress that mammography only works if you come in routinely. And so you can't do one at 40 and then not come back until 55. And so the point is to catch these things when they're at their infancy, very early, and that only works if you come in annually.
Yeah.
But as far as insurance goes, I don't know of an insurance that does not cover screen and mammography,
That's good.
including 3D. It's the
Yeah.
standard of practice right now.
Oh, that's awesome.
That all gets covered on that. The diagnostic goes into a slightly different category so that it goes toward deductibles and things like that. But
Yeah.
I do know that in our community, there's a really great group of ladies that if you are uninsured, then you can certainly reach out to our facility. You can reach out to main campus. We have several navigators throughout our system that can help get you in touch with the people to help finance that. So that's screening and diagnostic. So there's funds available for that across the whole system.
Oh, that's awesome.
One thing to do, though, to remember is that so women can schedule their own mammograms. They do not need a doctor's order to schedule their own mammograms.
Screening.
However, screening.
Screening.
However, we do need a doctor to send the report to. So
Okay.
that's really important because as an imaging clinic, we're not the ones that would be responsible for what happens with that.
Yeah.
So it needs to go to a healthcare provider. And if women don't have that, we can help connect them with a provider in the Atrium system.
Okay.
To have that report sent to them. But it has to go to someone that's a healthcare provider.
Sure. But that kind of makes it, in my mind, like a little less scary. Like, okay, I can literally just call and schedule my
Exactly.
screening. I don't have to do a bunch of steps beforehand. I can just
Absolutely.
call
And
and
they can do
schedule it.
online too. We've got lots of options to do it online. Any of the Atrium facilities that offer mammograms,
Yeah,
they have access to do it online, and then they can call. So
that's awesome.
trying to make it easy.
Well, and you guys are just so always out and about in the community and doing so much for our community. Is there anything that you want to talk about that's happening in the community that you guys have been a part of, or?
Well, we usually do a big event once a year called our Rosé at Metaloni, and that's been very successful. We try to do an advertising with the whole community. A lot of our physician clinics, a lot of other people show up. We have a great silent auction. Usually in the fall, we did it this past April, so we raise a lot of money just to help support some of our patients in that respect. But also, more importantly, awareness. But myself and my partner Laura Womack in Greensboro, we try to do as many health events as possible. We've got some events, races, and just different things like that we have a booth at.
Oh, that's awesome.
So yeah, we love participating in that respect.
Yeah. So Karen, I want both of y'all to answer, but Karen, what got you involved with outpatient imaging?
So surprisingly enough, I have a family history of breast cancer, and it was my grandfather. Yes. And so when I first was in x-ray school and mammography was not something that was super interesting to me, it just felt like, let's just be honest, I was 20 years old. And so it's that old ladies thing, and it's not something I need to ever worry about. But pretty shortly after I started my career out of school, my grandfather got diagnosed with breast cancer. And so, it was just a big deal because, that generation didn't talk about their health very much. And so to actually have known that information is pretty interesting. And so I just started doing my own research on it and realizing that 1% of all breast cancer is male. And so it is something that's there. It's not, I don't think it has quite the fanfare as it could. A lot of men are embarrassed, but we every week have many men that come to our facility with issues with their breast. But so that kind of got me started in breast health. And then through that, just started really, I felt a passion for it. I've seen over the course of my generations of doing mammograms now that I can see that we've saved lives. I see these women coming back, and yes, we've found your breast cancer, but we found your breast cancer, and you're still here to talk about it 10 years later. I think that's fantastic. And they go through the cycles of, very upset, of course, and things. And when they come out of the end of it, they're so appreciative that it was found early and that they do have the treatment options. And we do have a great cancer center that they can go to and great support. And they would come nowhere else but our facility to have the imaging done.
Oh, I love that. What a blessing to have a job that is so rewarding. Yeah. Anissa, what about you?
Oh my goodness. Well, I was in pharmaceuticals for a really long time, and so I've already had some relationships with a lot of the offices here. And so when I got the opportunity to join outpatient imaging I'm in my 15th year, it just seemed like a really good fit. And, mammography, I think, is a great way to be able to get out into the community. And I love that. I love just getting to know people and then tying it in with my clinics and supporting each other. And I think that it's really important if we could get women to come for their mammograms and then they feel comfortable with us, then they'll bring their other members of their family for other appointments. And we offer so many other amazing screenings that just save lives. And there's just such a fulfillment with that for me.
Yeah.
And I like to talk. And it all kind of works.
I love that. Yeah, because I would argue that somebody who is putting off their mammogram appointment is probably also putting off lots of other appointments.
Absolutely.
So this could be like the stepping stone to getting people into more, regular physicals, regular dental appointments, because it's all very connected.
It is. The screening studies, like you said, we do a wide variety of, if you've hurt yourself, we can get an MRI for that, right?
Yeah.
But we also are really great about offering like bone density scans or CT cardiac scores or things like that to
CT
see
lung screenings.
lung screens and things like that. So there's just a lot that you can do that we can head off those diseases as early as possible and get those treatments started as early as possible.
And to have the partnership with Atrium and to be able to to help guide them in and give the navigators and stuff like that. It's just a good connection.
Yeah.
For us.
Yeah. So are there any preventative things that come to mind that people should be aware of? Like, this might be a hokey one, but I'm just thinking of how some people I know will like put their cell phone in their sports bra. And I feel like that can't be good. So I don't know. Is there stuff that we should be just like aware of to?
So I'd say the most important thing is just really be aware of your breasts. Just to be honest, most lumps are felt by a partner. And ladies are so embarrassed to say that when they come out. I'm like, I think it's great.
Yeah.
It's fantastic. But just make sure that you are checking them. A lot of times soaping up in the shower, it's just a good time just to be aware when you're doing that, just to make sure that you're not seeing any changes that you haven't seen before or any lumps, any discharge, anything like that. And to not wait on that. If there is a problem, the sooner you can get to it, the better.
Yeah.
Yeah.
And be your own advocate.
Yes.
If you call and you get put off or whatever, be your own advocate.
Yeah.
Try to get on a wait list.
I
Try to get scheduled.
Totally agree with that. My mom found her own the second go around. She just felt it was funny, felt something was off about it, and kind of kept at it. And sure enough, it was breast cancer again. And she had a double mastectomy and still got breast cancer again.
I mean,
which is crazy. I didn't think that was even possible.
Yeah, they can't take every single solitary cell, unfortunately. So, but that's great that she recognized that there was a problem and just take care of. I'm sure she didn't want to go through that. It's like, not again.
Yeah,
I've already done this once. I don't want to do this again. But you have to hit it head on.
Yeah,
absolutely.
That was a weird thing for all of us because we really did kind of naively think like, oh, well, she had a double mastectomy, she's fine. So I think that's a good message to send out that, even if you have had that double mastectomy, you are not completely,
still need to do that.
It's still a chance that you can get breast cancer again. So to be on top of it.
And to speak to your family history and others that might have a history similar to yours, you have shared with us that you have gone through and went to the high-risk clinic and done some additional testing and things like that. There's a terrific high-risk clinic with Atrium and just a great group of advocates that are over there that can help you. So if you are at a high risk, then not only screening mammography, but also screening breast MR is an option. So it's contrast-enhanced mammograms. That's something new for the really dense breast tissue that they've been doing at the main campus. And there's all new technologies, and Atrium is great about adopting those and using those for the best benefit for the patients when they're coming in. So there's a lot of other options that you can do in a situation like yours with your family history.
Yeah, I know. I think I'm actually scheduled for an appointment soon. But excellent. I know one thing that she was telling me last time I was there, she always asks, like, how many drinks a week do you have? But alcohol is definitely something to limit to help with your
everything in moderation.
Yeah, everything in moderation. That's right. Well, Anissa, Karen, it was so fun to chat with you ladies.
Thanks so much for having us. We really appreciate it.
Brenda, we missed you. We'll see her next time.
Absolutely.
Well, where can we learn more about Atrium Health Wake Forest Baptist outpatient imaging?
Well, we have a website, obviously on the Atrium website. You can look at that. Feel free to call us anytime. Our number, 336-765-5722. But we're out there, and you can get us.
And you have 3 locations, correct?
We have 3 locations, yes, in Winston and in Kernersville, and our newest one is in Greensboro at the Friendly Center. So come out there and get your screening mammogram, do you some shopping. There's great places to eat over there. It's fantastic.
Oh, yes.
And some of the facilities have after hours, so you don't have to take time off from work, and Saturday hours as well.
Oh, that's
good
to know.
They can come in for their screening mammograms on the weekend, not have to take any time off, or super early. We start as early as 7 o'clock in the morning. Cool. So some people can come in before they're going to work. And so
awesome.
In and out, no time at all.
Lots of flexibility. Y'all make it easy.
We do make it easy. We do.
Well, thank you for coming on again. We'll have you guys back again soon.
Awesome.
And as always, you can find Forsyth Mags online at forsythmags.com. And you can find us on social media at Forsyth Mags. And if you enjoyed this episode, or if you've ever enjoyed one of our podcast episodes, we would love it so much if you would leave us a rating or a review. And that is a wrap for today. Thanks, guys.
Thanks.
The views and opinions stated on this podcast are solely those of the contributors and not necessarily those of our distributors or hosting companies. This podcast is copyrighted and cannot be reproduced without expressed written consent of Forsyth Magazines Incorporated. Ooh, that's a mouthful.